welcome to my channel. If you are new here, welcome, and if you're not new here, welcome back. The goal of my channel is to help nurses pivot from the bedside to remote work. I have 9+ years experience working in utilization review, and I've worked for 3 different companies. This first company is called Michigan Health, and they are hiring a utilization review coordinator, and this is for RNs. The shift is from 7 a.m. to 3:30 p.m., and the department is case management. Whenever I look for jobs, the first thing I look at is the qualifications or requirements. So the first thing I want to see is the credentials are RN. Education is at least an associate's degree in nursing. And they want you to have 3 to 5 years clinical experience, prior utilization review experience, and our certification in utilization review or case management is preferred but not required. Basic knowledge of coding is preferred. The next position is with Enlight. Now, Enlight has multiple remote positions. If you look in the second column here, but make sure whenever you look at the job, read the description. Some jobs say remote in this column, and then you read the job description, and it will say hybrid. So the first job I want to go over is telephonic case manager. This is a case management position in the United States. It is full-time. And as you see here, this is a full-time job. Flexible work from home position, and can be located anywhere in the U.S. They do require you to have a California RN license, and they prefer Pacific Mountain or Central Time Zone. And qualifications are associate's degree or bachelor's degree in nursing or related field, 2+ years clinical practice preferred, workers' compensation related experience is preferred, ability to advocate recommendations effectively with physicians or providers, employers, and customers. Ability to work independently. Knowledge of basic computer skills including Excel, Word, and Outlook email. Proficient grammar, sentence structure, and written communication skills. And they want you to have an active RN license required. Must be in good standing. URAC recognized certification in case management. This is CCM, CDMS, CRC, CRRN, or COHN, COHNS, RNBC, ACM, CMAC, CMC, preferred but not required. Don't let all these acronyms scare you away, still apply, and you must have reliable internet. Second position is also a telephonic case manager, but this is for nurses in Toronto, Canada. This is a full-time position, and this is a full-time position, flexible work from home position, and can be located anywhere in Canada. Requirements are associate's degree or bachelor's degree in nursing or related field, 2+ years clinical practice preferred, workers' compensation related experience is preferred, ability to advocate recommendations effectively with physicians and providers, employers, and customers, ability to work independently, knowledge of basic computer skills including Excel, Word, and Outlook email, proficient grammar, sentence structure, and written communication skills. Active RN license required, must be in good standing. It looks like this has the exact same acronyms of certification in case management, preferred but not required. And don't let this deter you. Whatever you need to know on the job, they will teach you on the job. And must have reliable internet. And this third position is a telephonic case manager, and this was also full-time, flexible work from home position, can be located anywhere in the U.S., and a compact and California RN is required. And this one actually has a Spanish bilingual is preferred. And this position, I believe it may have the same exact requirements as the first two. The only exception is they don't have all the additional certifications. So you must have an associate's degree or bachelor's degree in nursing, 2+ years clinical practice is preferred, workers' compensation related experience preferred, knowledge of basic computer skills including Excel, Word, and Outlook email, proficient grammar, sentence structure, and written communication skills. Active RN license required, must be in good standing, and must have reliable internet. And I do want to also point out that if you go to the description box below and you scroll towards the end, you'll see a option regarding resume tips and how you want to format your resume. just make sure you add platforms because you want to promote how you are tech savvy on the job. So including Microsoft Office, Cerner, Protouch, Meditech, Allscripts, Sunrise, etc. I would say include your platforms that you've used for each job. And even if you, let's say, are a year or two out of nursing school, you can also include the platforms you've learned whenever you've done your clinical. So I would include every single platform for every hospital you worked with. And also make sure you write your resume with this in mind: what you did, why it's important, and how it relates to the job that you want. You don't want to just list a couple of several tasks you've done. You want to actually make sure that it relates to and translates to the job that you want. And here's my example I have here: Proficient in electronic health record documentation to ensure continuity of care, to provide insurance payor to determine medical necessity. And if you scroll down past that, I just basically give you an example of a bedside nurse versus an insurance nurse. So a bedside nurse has a patient, an insurance nurse has a member, and if you just read there, you'll see exactly what the insurance nurse does and how the bedside nurse does her or his job, and how it relates to how the insurance nurse does his or her job. Network Health is hiring a RN care manager. This is a full-time position. It is 40 hours per week. That is 8 a.m. to 5 p.m. Monday through Friday. The requirements are graduation from accredited school of nursing, bachelor's degree in nursing is preferred, RN licensure in the state of Wisconsin, case management certification is preferred, 4 years of clinical healthcare experience as an RN is required, previous experience in case management, utilization management, insurance, or managed care is preferred, experience with Medicare or Medicaid is preferred. Next role is an RN coordinator, utilization management. This was actually posted on March 27th. It is also full-time. Candidates must reside in the state of Wisconsin for consideration. And requirements are current RN licensure in Wisconsin, Bachelor of Science in Nursing is preferred, associate's degree in nursing is required, minimum of 4 years clinical health experience as an RN required, experience in insurance, managed care, and utilization management is strongly preferred. And this last position is a quality care coordinator. You also must reside in the state of Wisconsin. I believe all three do require you to live in the state of Wisconsin. And yes, so it's all three. This is for nurses in the state of Wisconsin. The requirements for this position: bachelor's degree in related field is required, bachelor's degree in nursing preferred, 4 years clinical RN experience preferred, experience in basic data analysts, quality improvement, or HEDIS medical record review, preventative care, or health plan experience preferred, and a Wisconsin registered nurse licensure is preferred. Curana Health is hiring for a case manager, RN, LPN, or social worker. This job is full-time, and we're going to go straight to the qualifications. You must have 1 year of clinical practice experience in at least one of the following areas: case management, home health, critical care, medical surgical, discharge planning, concurrent review or obstetric or neonatal care, proficiency using basic computer skills in Microsoft Office such as Word, Excel, and Outlook, including the ability to navigate multiple systems and keyboarding, and case management certification is preferred. And regarding your certification and licenses, you must be an RN with a license that's active and unencumbered state license in the state where job duties are performed is required. A BSN is preferred. And if you're a social worker, you must have an active licensed social worker, and a bachelor's degree in social work is required. The next job is a care manager LPN. This is on the Eastern time zone, and for this position, the requirements are: must hold an active, unrestricted compact LPN license, ability to obtain additional state licenses as needed, and 2+ years of experience in nursing is required. Care settings may include inpatient, outpatient, or skilled nursing facilities. And this position is 100% remote, requires reliable high-speed internet connection. Now, besides this care manager LPN role in the Eastern time zone, there's also one available in the Central time zone, and it has the exact same education and experience required.